Hello and welcome everybody to yet another video from me, myself, the Eagle Scout Prepper, and yes, I am an Eagle Scout. So today, by popular request, I have made a new video on my smaller medical bag. So some of you might have seen the video from my bigger bag, that of which I'm not currently using anymore. So I decided I'd make a new video on my new bag after releasing some pictures to the community. So this is my personal EMT bag that I carry in my vehicle. And we're just gonna jump right into it. Now we got up here in the top shears and then pin light. And then you see PPE right here, gloves. I got 4 sets, 1 pair of black, and then 3 pairs of blue. Got some tape right on the outside here, a couple of things of oral glucose. We got some tweezers, and we have a Sharpie for triaging. And then this exterior pocket over here, this has more personal protective equipment in it, which is always really important. In the sock, which I'm carefully undoing, is actually safety glasses. Always a very important part of PPE. Got to protect your eyes from any kind of spit or blood or vomit or anything like that. And of course we got an N95 mask. And then we also have a CPR resuscitator. There's adult and infant masks in there, along with valve. And then we have a notebook for taking notes. And then, because every good medically prepared person should have a place to dispose of their first aid waste, bandages and stuff, I do have some small roll of doggy pick bags. That's one of my signature items that a lot of people joke about me carrying, and I don't care. It works pretty great, so it's a good way to dispose of your bandages and stuff after caring for somebody. And then I have my Littman stethoscope here, Littman lightweight. It's custom engraved. Yeehaw. Alright, and then we have kind of separated into 2 sides here. So there's a couple of mesh pockets, and the mesh pockets kind of have all the real basic ouchie boo boo stuff. And then this side here is mostly, breaks and sprains. I have some stuff for burns, and then I have my regular wound care stuff. This is the only thing on this side that's for regular wound care. And then this side is mostly trauma, and then over here I have vitals taking stuff. So yeah, let's get into it. So right on top, obviously, we have a 3-inch roll of gauze, which actually goes on this side, but it kind of just fits really good right there. So that's obviously for multi-purpose. It could be for breaks and sprains. It could be for burn treatment, whatever. 1 roll of 2-inch ace wrap and 1 roll of 2-inch Coban. Always important to have for securing dressings, splints, and whatnot. We have 3 things here of triangular bandages. Gotta have those triangular bandages for breaks and sprains, slings, swaths, splints. Got a good old Sam splint. I love those things. And we have a finger splint that came with one of my original kits, which is over there. And then, of course, we have a cold compress for your breaks and sprains and what else, musculoskeletal injuries. Then we got an emergency burn gel, Alocaine here. This is the only thing that I personally use for handling minor first-degree burns, because it's got that pain relief element to it, and then aloe is great for that. And we got some Icy Hot. That's also for your minor breaks and sprains. And then this is a burn dressing. pre-soaked. Of course, you can just use a regular dry dressing. They're going away from specialized dressings. And I'm actually considering even taking that out and switching to one of the newer antimicrobial dressings, the silver dressings that they're coming out with now. And then we have isopropyl alcohol 50% spray. So this is 50% isopropyl alcohol. And that's obviously for wound cleaning. We got some good old-fashioned sterile saline. And some Johnson & Johnson baby powder. I hopefully don't need to explain what this is for when you're out at Boy Scout camp and it's hot. And yeah, saline is for rinsing burns mostly, or for rinsing wounds or eyes if necessary. Do have afterbite, very common to treat out in the woods at camp. I use this bag a lot at camp, and I also use it a lot just out and about. So, and we have MediFirst eye wash, rinsing eyes out to if they get something in their eye. Bactine, that's great for cleansing wounds and stuff as an alternative to alcohol spray, and it also acts just like triple antibiotic ointment. So it's really good for that. And then we also have Chigger-X here. Chigger-X is great for chiggers, of course, as the name would imply. Calamine lotion for all of those scouts that wander too far into the bushes and get covered in poison ivy. Yeah. Scouts like to hurt themselves. And then 1% hydrocortisone anti-itch cream is always good to have instead of triple antibiotic ointment. I do have some triple antibiotic ointment in my day pack that I carry with me, but not in this bag, because for most civilian aspects, I'm not really using that. We're going away from overuse of antibiotics a lot. And I've had a lot of doctors tell me to use hydrocortisone as a replacement cream because it helps with the healing factors and it helps with the itching. So, but without that overuse of antibiotic, or improper use of antibiotic, really, I should say. And then we have some Band-Aids here. We got alcohol wipes, and we have 2-inch gauze pads. And I'm not going to pull all of that out because there's just a lot of it in there because that's what I use the most. So I keep the most of that in there. So, and then we have 2 Mylar heat sheet blankets, emergency blankets here for treating shock. And then I have 2-inch gauze rolls. Oh, I grabbed the Curlex. Let's see, where is it? There it is. 2-inch gauze rolls. That's for securing dressings to wounds. Curlex, which can be used to pack wounds. This can be used to secure bulky dressings. Just good thing to have. Very useful there. Quick release reusable tourniquet that came with one of the kits. I kind of think of this as like an IV tourniquet. Not really useful for stopping bleeding, but it has its uses sometimes to help palpate. And then we also have some ammonia ampules. That's great for scouts when they don't want to wake up in the morning. JK, just kidding. Medication pouch, just your standard first aid kit medications. There's some, okay. We got some Bayer aspirin, some Advil, Tylenol, and in the back I have some Claritin loratadine 10 milligram. And I'm also going to add in, get a box of Benadryl to add in there as well. Add in a couple tablets of Benadryl. And then, of course, I have my trauma pack. Now, the reason this is in a separate pouch from everything is because I want to be able to pull this out quickly and toss it to somebody and say, here you go. That way, I don't have to give them the whole bag, especially if I'm using it for something else, or if I have to get to my more minor trauma stuff below it. I don't really want to have to pull all of this stuff out just to get to that when I can just pull this out, this little pouch. You'll notice most of the stuff on this side, I could just pull it out straight from the top without compromising everything else, but this side is not like that. So this one's kind of a little full pouch. We have 2 Israelis in here, a 4-inch and a 6-inch. Of course, I know I can use any type of bandage. And then we have 2 hyphen vents chest seals here. Yes, there is two. And then we have C-Lock Z-Fold gauze, and then some regular NAR compressed gauze, North American Rescue. And then we have a Gen 7 cat tourniquet, genuine. And then I have two packs here of quick clotting sponges. So really useful for your emergency stop the bleed cases and stuff like that. I've never had to use that, and God forbid I ever do. Regular 5x9 combine pad. I only have one in here. This is a small and compact kit, and I could probably fit quite a few more of those and quite a few more of these, but this is all I really want to carry, because if I am treating bleeding, I'm not going to be using this as a primary. I will use this for minor stuff to stop bleeding, and then use that as a dressing. But if I can't stop it with this pretty quickly, I'm going to that. Because most of the time I'm not really close to EMS when I'm actually using this bag. So I'm going to advanced methods of hemorrhage control. All right, and then we have a 12x30 trauma dressing for those big giant abdominal wounds. God forbid I ever use that. Of course, that can also be cut up into lots of smaller bandages, so that makes up for not having tons of these combine pads, because I could always cut that up if I really needed to for lots of bandaging to stop bleeding injuries. So in this other mesh pocket is all of this stuff that I have in my hand here. So I'm gonna set all this stuff down here on the corner of the bed. We got an eye shield. This is good for those kids that get something in their eye and have an injury and you want to just protect it. And of course we have eye pads. And just depending on the scenario, would depend on what I might use these for. Like, for example, this could be used for a gouged out eye, and this could be just used for a regular eye injury. And then we have wound closures, and yeah, I know I have the little instruction manual. That just helps to keep them all together, because they kind of sit in the trifolds of it, and it keeps all of my wound closures together. But I just have a bunch of steri strips, wound closure strips. And then we have moleskin and molfoam. So if you don't know the difference, moleskin is for preventing blisters when you have hot spots. Molfoam is for treating blisters. Now, you can layer moleskin. As you can see, I have tons of moleskin in there, and you can definitely layer it to make it thicker like molfoam. But it's so easy to just carry the two that I just do, because it's so easy that way. But you shouldn't really be just putting a single layer of moleskin over a blister. You want to put it around the blister and layer it up to protect that blister. And sometimes you may even need to layer molfoam, so just keep that in mind. This is my BP case. I'm not really going to pull out my BP cuff. Obviously, I would use my stethoscope to auscultate the BP sounds, but I'm not going to pull out my BP cuff. I'll unzip it, but I'm not really going to pull out that. So yeah, you can see that's in there. Pulse oximeter, nice and basic, simple, small, lightweight pulse oximeter. Not really for professional use, just, taking pulse oxes for asthmatics. I do have a family member that is asthmatic, and then I also have a scout that is. And then we have a good old thermometer here. This is a 60-second thermometer. I want to get a better thermometer than this, but for now this is what I have. I just don't have the money to get something fancier, or at least I haven't spent the money to do it. But that is for taking temperatures. Common thing with scouts is somebody gets a fever, gotta take a temperature. So scouts will say, I got a fever. Well, prove it. I'll take your temperature. Make sure you're just not faking it or being homesick. So yeah, that's pretty much it. That's in this bag. And of course my day pack kit is kind of different. It mostly just has band-aids and stuff like this. It has a little tube of Afterbite in it as well. It also has one thing of oral glucose in there, as well as a providone iodine swab for cleaning wounds, just one. And then it has a single 6-inch Israeli bandage, some small, compact hyphen vent chest seals. It has the hemostatic and non-hemostatic packing gauzes, and then a cat as well as a soft TY tourniquet. So, and then it has some regular 4x4 and combine pad gauze, and so that kit's not really that extensive. That's what I carry with me into grocery stores. I was carrying an ankle kit for a while, but I have higher boots now, and that doesn't work with that. So I just keep my personal trauma kit in that, and I just carry it with me into stores and stuff. Nobody really knows it's there. It's my regular day pack. I have all my other stuff in there, my wallet and whatnot. So it's coming in with me anyways. All I did was add a few other things in there, and that helps me to have that stuff on me, especially in this crazy day and age. So, God forbid I ever use any of that. Not saying that it's going to happen, but prepare for the worst and we hope for the best. And that is how you are prepared. And thank you for watching this video with Eagle Scout Prepper. And I challenge you to do your best to be prepared.